Let's say you have a young athlete who suddenly collapses after running or exercising. Why is that happening? This is very common in hypertrophic cardiomyopathy. What is that? That's the asymmetric septal thickening, okay, in the left ventricle. So now what happens? Let's look at the normal pressure volume curve. So normally you fill up the heart, that's called as preload, and then you contract, then you eject, and then you relax again. What's the width of the curve? That's called as stroke volume. Now, what happens in hypertrophic cardiomyopathy, because of the ventricular wall thickness, you have less diastolic filling. And especially when you run, because of tachycardia, you even have less diastolic filling time. So when you exert, you have less diastolic filling time, and because of the thickness of the ventricular chamber, you have less end diastolic volume, less preload, less stroke volume, and eventually less cardiac output will cause less blood flow to the brain, and then eventually you'll collapse or have syncopal episode. Now, these patients who have syncopal episode and have hypertrophic cardiomyopathy needs further evaluation to see if they need ICD placement or you have to do some septal reduction treatments.